Hello everyone, welcome back to Parasitology and welcome to the continuation of the discussion of Lesson 5, Hemoflagellates. This video will focus on the last group of hemoflagellates, which is the Leishmania species. Okay, compared to Trypanosoma species that we discussed on site, this genus, or this group of parasites are considered obligate intracellular parasites. What does this mean? So unlike Trypanosoma cruzi that can either be found in the blood or sometimes in the organs, o kaya naman Trypanosoma brucei, which primarily reside in the different fluids like blood, spinal fluid, etc. Leishmania parasites inhabit cells of the human body. What kind of cells? Cells of the reticuloendothelial system. Again, Leishmania species are obligate intracellular parasites that invade or infect cells of the reticuloendothelial system. As a general rule, hemoflagellates are vector-borne, and the vector for Leishmania species is the phlebotomous fly, and in some cases also the Lutzomia fly, and the common name of the phlebotomous fly is the sand fly. This parasite or this group of parasites are known to be zoonotic, meaning they can infect both humans and animals. What is the mode of transmission? Ganun pa din, insect bite from the vector. For the infective stage, take note, hindi na po metacyclic trypomastigote yung infective stage niya. So yung word na or yung developmental stage na trypomastigote, pang trypanosoma lang. For Leishmania parasites, ano na po yung infective stage natin? Promastigote already. So just like your Trypanosoma species, we also use the word or the descriptor metacyclic. The infective stage of Leishmania parasites is metacyclic promastigote. For the vector naman, ano yung nai-ingest ni sandfly pag magba-blood meal na siya in an infected person? Ano yung nakakain niya? Ang nakakain niya is yung amastigote na usually nakapaloob or nandun sa loob ng reticuloendothelial cells. So, like macrophages, ganon. So, the mastigote is in the reticuloendothelial cell. Tapos, nung nag-blood meal si vector, nahigop niya yung reticuloendothelial cell na yon, nandun yung mastigote. For the diagnostic stage, since, they are inside the reticuloendothelial cell, that is the stage that you would find them. Mastigote din. Okay, there are different kinds of Leishmania infection. So we are going to discuss 3. The first one is cutaneous leishmaniasis, and then the second is the mucosal or mucocutaneous leishmaniasis, and then the third one is visceral leishmaniasis. And Leishmania, kung mapapansin nyo, Leishmania species, hindi natin siya malagyan ng species na yung specific na species niya kasi super dami nila. So what I want you to do is I want you to refer to table 2.4 and 2.5 para makita nyo yung very complete list kasi ang dami talaga, ang daming species. But for this discussion, we're going to cite yung mga most clinically significant, but for the rest, please, as a reading assignment, please refer to table 2.4 and 2.5. Okay, for cutaneous leishmaniasis, sino yung mga most commonly or most significant species that cause this kind of infection? You have here Leishmania tropica, Infanto, Mexicana, Braziliensis, and Chagassi. Okay, before we proceed, ano kayong pinagkaiba ng mga parasite na naka-blue and mga parasite na naka-red? Okay, these species are color-coded, wherein those that are written in blue, those that are written in blue, they are known as causes of Old World Leishmaniasis. Okay? And then kapag red, sila naman yung nagko-cause ng New World Leishmaniasis. Ano yung pinagkaiba ng Old World and New World? So these terms kasi are used to refer to countries, or regions in the world na kumbaga sa history, may kinalaman siya sa yung yung pagka-discovery ng mga countries na yon. So, sino yung mga countries as part of the old world? Ito yung mga Europe, anong tawag dito? Sila yung mga usually nasa Europe or Asia. And then, yung mga New World countries naman, sila yung mga nasa Central and South America. So, in short, they are assigned certain regions based on where they are prevalent. So, dun sa mga Old World countries like Africa, Asia, Mediterranean, ito yung mga prevalent na yon. Asa na tayo? Tropica and Infantum. Pero yung mga New World countries like the Americas, in Central and South America, ito po yung mga prevalent. So, Mexicana, Braziliensis, and Chagassi. Okay. For mucosal or mucocutaneous leishmaniasis, ito naman sila. So, again, blue ay taga-Old World and ang mga red ay taga-New World. And you can see, okay lang, no? As you can see, ay, bakit parang may nag-overlap? Okay lang yun. Ganun talaga. So, depende na lang on how the parasite will affect you kung ang manifestation niya ay cutaneous or mucosal. So, ayan. Kaya pwede sila mag-overlap. And then the third kind of infection is the visceral leishmaniasis. So, when we say visceral, we are already pertaining to infection of the internal organs. Okay, pag cutaneous, ano ba yung sabihin ng cutaneous? Diba skin? So, mostly skin, dermal, or ang tawag dito? Skin infection or nasa skin yung manifestation niya or symptoms niya. Pag mucosal naman or mucocutaneous, usually nasa mga inner lining of our body like mouth, nose, yung mga moist surfaces natin. Pero pag visceral, ang mga damaged part of the body na ay yung mga internal organs. Kaya visceral leishmaniasis. And who are the significant causes or significant species? Leishmania donovani, tropica, and amazonensis. Okay, so let us look at the life cycle of Leishmania species. Again, what is the mode of transmission? Syempre, insect bite, no? Insect bite of what vector? The sandfly, or the phlebotomous fly, or the Lutzomia fly. Ako, nawawala yung pointer natin. Ayan. So, ayan sila. Okay, step number 1, nag-blood meal sila dun sa person or dun sa patient, and they introduce our infective stage, which is the metacyclic promastigote or simply the promastigote. So, nakapasok na po ang promastigote and sabi nga natin, they are obligate intracellular parasites. So, the first response of the body is kakainin siya ng ating mga reticuloendothelial cells that they are also part of the immune system. Meaning, ang intention talaga ng ating mga reticuloendothelial cells like macrophages and dendritic cells is to engulf these parasites so that they can beat or they can combat the infection. However, kumbaga yung intention ng cells natin ay good to protect us from infection. However, yung mismong act na yon or yung mismong engulf dun sa parasite, yun yung nakakatulong sa development ng parasite. So, the intention was good, but the result is not so good kasi yun yung naging step para lalo silang mag-cause ng infection dun sa ating patient. So, again, what is the type of cells that these parasites invade or not actually invade kasi dapat kakainin sila. So, anong cells yon? Reticuloendothelial system. Or cells of the reticuloendothelial system. So, this includes yung mga phagocytic cells natin like macrophages, pwede ding dendritic cells. So, pag nakapasok na si promastigote sa ating reticuloendothelial cells, they will now transform into their intracellular form. If you remember our discussion, yung APET, which of the 4 developmental stages are considered yung intracellular form nila, na kahit sa trypanosome, pag kumain na sila or pumasok na sila sa organ, nagiging anong stage sila? That stage is a mastigote. So, intracellular form or intracellular stage will always be the amastigote. Now that they are inside the cells, they can multiply. So, multiply, and then sasabog ang cell, and then the amastigotes can transfer or can be engulfed or phagocytized by other cells, and then the process will just repeat. So, habang madami sila, ayan. So, papadami sila. And then, time will come, Time will come na may bagong sandfly na dadating at dadapo at magte-take ng blood meal dun sa ating patient. And in doing so, the sandfly can ingest our infected macrophages. So when they infect the macrophage, sakto, nandun yung amastigote. So they will now ingest the amastigote. Once inside the vector, ayan, so ingestion of parasitized cell like the macrophage. And then, once inside the vector, the amastigote will now transform into promastigote in the gut of the vector. And then the promastigote will continue to multiply until they are now ready again to be inoculated or introduced to the next host. So, very easy lang po yung life cycle niya because how many stages lang yung nakita natin dito? Di ba dalawa lang? Promastigote and amastigote. Unlike trypanosoma, na ang dami niya pinagdaanan, di ba? Naging epimastigote siya, and etc. So, dito, dalawa lang sila. Promastigote and amastigote, nagsasalitan lang. Okay, so let us now go to the pathophysiology of the different types of infection caused by Leishmania species. The first one is the cutaneous leishmaniasis, which again infects the skin kasi cutaneous. Okay, this is the most common form of infection. Ayan po, same vector. And it is characterized by skin lesions and ulcerations. Again, we can divide the species into two groups, those that are prevalent in the old world countries like Africa, Asia, and Europe, and the New World, yung mga Americas. So, ito po yung mga, please memorize, yung mga species based on what area of the world they are prevalent. Okay, so what are the significant species that cause cutaneous leishmaniasis? The first one is L. tropica, okay, which causes chronic infection. So, when you say chronic, medyo matagal yung course of infection niya. So, pag naging infected si patient, that disease can last many months or even years. So, it can last many months or for a long time because it is a chronic infection. And the ulcers or the lesions or the sugat that this parasite causes is described to be dry or crusty. So, walang pus, walang ganun, very dry lang siya. And it is also described as urban. So, maybe because this type of infection or this type of lesion is usually found in urban areas. Yung mga nasa city. It's giving BGC, mga ganon. So, in urbanized areas, ito yung kind of lesion na na-observe. That's why its nickname is urban oriental sore. The next significant species naman is L. major, which this time causes a shorter infection or acute infection, typically 3 to 6 months only. How about naman yung characteristic ng lesion na kinokos niya? The lesions caused by L. major is usually or typically moist or mamasa-masa, and this kind of infection is usually found in rural areas. So, I would suggest na mag-develop kayo ng mga mnemonics para mas maalala nyo sila. Pero very important talaga, even in the 4th year level or in the board review, you need to memorize tropica, chronic, dry, urban. L. major, acute, moist, rural, oriental sore. For L. major, meron din siyang, so it's a zoonotic species and it can also infect sand rats. Our third clinically significant species is L. ethiopica. It is considered as a mainly transmitted parasite, but it is described as a neglected. So, medyo hindi siya na-explore masyado, pero medyo significant din yung number of cases na nakokos niya. So, L. ethiopica. And this is also zoonotic and can be transmitted or can be found in sandfly or rock hyraxes. And lastly, we have L. mexicana, which causes the chiclero ulcer or the bay sore. The chiclero ulcer or the bay sore. Ayan. So, this is an example of the, tawag dito? Reservoir host, for Leishmania species. So, let us explore, the different types of lesions caused by L. tropica, which is described as dry. So, mapapansin natin crusty siya. And then, kapag major or L major, they cause moist or mamasa-masang lesion. And then, pag Chiclero ulcer, okay, so sabi ng ating Markel and Vogt, when we talk about Chiclero ulcer, majority of the cases is that they are found, or this type of lesion is found in ears. Just like what is shown in this picture. Okay? Chiclero ulcer, majority of the cases found in ears or affect the ears. Okay, how do we diagnose cutaneous leishmaniasis? So, tingnan natin yung lesion, no? I-biopsy natin siya. So, tissue biopsy, punch biopsy, or lesion scrapings where we can find, no, amastigotes found in the reticuloendothelial cells that are resident in that particular body part. So, yung reticuloendothelial cells kasi natin, they are not circulating cells. Ano sila, mga resident phagocytic or resident immune cells of our tissue. So, may skin, or kung visceral yung pag-uusapan natin, may mga resident phagocytic cells din sa mga different organs. So, pag binayopsy natin yun, makakakita tayo ng Leishmania amastigote. May tuloy pa natin, no? So, biopsy, it's a type of histopathologic technique. So, histologic examination, tignan sa microscope, ano nakikita natin, kung may amastigote ba doon. Serum anti-leishmanial antibody. So, this is an serological or immunological assay where we don't look for the actual parasite, but instead, we detect antibodies that have formed in response to infection. We can also culture the parasite, meaning hindi lang siya natin binayopsy at in-stain ang tissue at tinignan sa microscope, pero pwede natin siyang i-grow in the laboratory. And we are going to use some growth media or culture media. What is the possible culture media that we can use? We can use the Novi McNeil-Nicole medium or the Schneider's Drosophila medium. And lastly, gagamit tayo ng hypersensitivity test or skin hypersensitivity test, which is Montenegro test. Ano nga ulit yung hypersensitivity test? Diba yun yung magtuturok tayo ng antigen or ng sterilized, meaning hindi na siya nagkakos ng infection, sterilized parasite in the skin, and pag nag-react, ibig sabihin, guilty, no? Or pag nag-react, ibig sabihin, positive for infection. So, what do you call that kind of test for Leishmania infection? Montenegro test, or minsan, Montenegro skin test. Yun ang tawag sa kanya. And so, this picture will show you, ayan, yung mga amastigote that is found or that was obtained from our reticuloendothelial cells. And ayan, this is the Novi McNeil-Nicole medium. Okay, for the treatment of cutaneous leishmaniasis, I will leave this to you as a reading assignment kasi puro drugs lang naman siya, mga nice to know. But take a picture of this slide and ayun, read or familiarize yourself. No? But these are just different kinds of drugs. Siguro what I would want to emphasize, kung nag-CPH kayo, okay, nice to know, no, na pwede palang gamitin ang Leishmania, tapos i-combine mo sa BCG vaccine or Bacille Calmette Guerin vaccine. And saan nga itong vaccine na to? This is actually the vaccine for tuberculosis. No? Kung nag-CPH kayo, alam nyo dapat yun. BCG, the vaccine for tuberculosis. Ang galing. So, pwede din pala natin siyang gamitin for cutaneous leishmaniasis. Okay, for the epidemiology of cutaneous leishmaniasis, the primary mode of transmission is insect bite, but contact infection, no, or direct contact is also possible. So, yung skin mo na may lesion, dinikit mo sa skin ng another person na siguro may open wound. Okay, pwede pala yun. Pwede pala mag-transmit yung infection. Pero, ano lang to, no, minor route, or very rare case, no? Ang primary pa din natin ay dapat may mag-i-inject talaga or may mag-i-inoculate sa'yo na sandfly. For vaccination, okay, amazing. So, inoculation of serum of patient with lesions to non-immune person can be a preventive measure pala. No? And then, L. tropica is a known cause for human vector human in transmission, which usually occurs in urban settings, while for other species like L. major, na prevalent sa rural settings, diba? Rural oriental sore, mostly ang form of transmission niya is zoonotic. Ano ibig sabihin nun? Si sandfly, kinagat si reservoir host, si animal, yung mga, ang tawag ito, yung mga sand rat, diba? Tapos, lumipat sa tao, tas kinagat ulit. So, that is what we consider zoonotic transmission. Okay, next is mucosal or mucocutaneous leishmaniasis. And this time, hindi lang po basta sa skin yung ini-infect ni parasite, but the inner linings of our body, like yung mouth, lips, yung palate natin, yung sa loob ng mouth, yung roof ng mouth natin, yon, yung mga moist lining, di ba? Yun yung mucosal lining or mucosal leishmaniasis. Same vector pa rin po. And the causative agent is mostly L. tropica and L. major pa din. Okay, what are the symptoms? Instead of just simply the skin, the same manifestation can be found in the mucosal lining, like the nose, the pharynx, diba? Ayan, the palate, yun yung pwedeng mangyari. But almost similar pathophysiology, and of course, similar life cycle. Oops. So, what is an example of an infected mucosal lining? Pasintabi na lang po. But this is what can happen. Diba? The whole nose and mouth, whole area of the nose and the mouth is already affected. Okay, proceed na tayo sa next. What is the treatment? Medyo hindi na natin pag-uusapan yung epidemiology kasi same lang naman, tropica and major. For the treatment, we can use these drugs. So, assignment na lang po, paki-memorize or nice to know, familiarize ang drugs. Now we go to the last infection na. O, diba ang bilis natin? Last infection, visceral leishmaniasis. And anong sabi natin pag visceral? It is already affecting the internal organs. Same vector. What is the common name for this kind of infection? So we don't, aside from just calling it visceral leishmaniasis, it can also be called Kala-Azar fever or dum-dum fever. Ayun. So, Kala-Azar actually means black fever. Okay, so Kala-Azar is black fever, and it is also known as dum-dum fever because it is discovered, nor it was observed in Dum-Dum, India. So, Dum-Dum is a place in India. And what is the most significant cause of visceral leishmaniasis? It is Leishmania donovani or Leishmania donovani complex. Leishmania donovani causes dum-dum fever. L. infantum, which is part of the complex, can also affect children and HIV-infected patients, meaning they affect yung mga immunocompromised or yung mga people na hindi ganun ka-powerful ang immune system, immunocompromised individuals. L. chagasi can also affect children, and this parasite or these parasites are known to be zoonotic, meaning they can also infect animals such as dogs and rodents. Okay, what are the symptoms or what is the clinical manifestation of visceral leishmaniasis? Sabi nga natin, it causes Kala-Azar or in English, black fever. Why black? Because the manifestation is the blackening of the skin. So later we will show pictures kung paano nangingitim ang skin in Kala-Azar. This infection also causes abdominal swelling. So nag-enlarge yung abdominal region due to swelling of or enlargement of the liver and the spleen. So hepatomegaly and splenomegaly. Aside from the blackening of the skin, pwede din yung patient magkaroon ng certain lesions or characteristic lesions described as or identified as dermal leishmanoids. And may picture tayo nan later. This infection can also mimic malaria. Paano yung pagka-mimic? Hindi naman sila nag-i-invade ng RBCs, pero yung characteristic ng malaria na nagkakos sila ng intermittent fever. Diba kung nag-CPH kayo, yung isang characteristic ng malaria is that nagkakause siya ng periodic, no, na fever. So, may fever ngayon, and then after, let's say, 24 hours, or after every 48 or every 72 hours, biglang magkakaroon ulit ng fever. So, ibig sabihin, intermittent siya. Ganon din yung characteristic ng visceral leishmaniasis. Nagkakause siya ng intermittent fever. It also resembles typhoid fever. In what sense, no? In the sense na it also causes diarrhea or basta general feeling of ang pagkasabi sa or ang pagkasulat sa textbook ay general feeling of ill health. In Filipino, masama yung pakiramdam. So, yun yung signs and symptoms ng kala-azar. The person can also experience anemia, weight loss, and neurologic symptoms such as burning sensation of feet, deafness, and multiple cranial nerve palsies. Okay, para mas malala natin, visceral, no, internal organ, what kind of organ? Liver and spleen. So, this is the example of, ayan, no, organ, abdominal swelling, okay, with hepatomegaly and splenomegaly. So, dapat ito lang yung liver natin, di ba? So, ito lang yung spleen. Apakaliit lang niya, di ba? Bean shape lang yung spleen. Tapos biglang, ganyan na siya kalaki. Kung paano siya drawing nung, siguro doctor yung drawing nito. So, ganun siya ka-enlarged. And then, ito naman yung characteristic dermal leishmanoids. Leishmanoids natin. And then, this is the example of blackening of the skin. Okay, pakibasa na lang po yung yung picture na to, but kunwento niya lang din, no, kung ano yung sinabi natin kanina, like the hepatomegaly and splenomegaly. And here you can see, again, another picture of abdominal swelling. How do we diagnose this kind of infection? We can do microscopy. Okay. Culture, nasabi na natin yan kanina. We can also do biopsy, especially of the liver and spleen. No, the top two organs na, or the top two internal organs, or visceral organs na na-affect nila. Examination of the buffy coat films of the venous blood. And then, diagnosis, wherein, again, we use laboratory animals. And what animal is being used here? Hamster. Serological or immunological assays, pwede din. Ipakibasa na lang po, no? And then, very interesting, no? This is, siguro sa lahat ng yan, ang gusto kong matandaan nyo is the formal gel test, which is a screening test for kala-azar. So, what is the procedure of the formal gel test? Okay, here we use serum. So, may pagka-immunological test din to. We use serum, and then we mix it with formalin. And when we mix, we can expect, no, that a positive result will form a jelly consistency of the serum. So, bakit siya nagkakaroon ng jelly consistency? Ganito yung nangyayari. So, you have your serum, your test tube, lagyan ng formalin, and then positive result is the presence of gel-like consistency. Okay, the principle behind this test is that in visceral leishmaniasis, due to the increased concentration of antibodies against the infection, somehow, no, nagkakause siya ng coagulation ng ating serum. So, pag nilagyan siya ng formalin, magko-coagulate siya, and magkakause siya ng gelation or gel formation of your serum. So, bakit siya naging jelly? Dahil sa antibodies produced in response to infection. And this is a good screening for kala-azar or visceral leishmaniasis. So, ito yung microscopy method natin. And then, ito again yung culture method using our NNN medium or the, ano nga ulit yun? Novi McNeil-Nicole medium. For the treatment, pakibasa na lang po. And then, epidemiology, there are two forms of transmission. So, just like yung L tropica and L major natin, no? In urban settings, mostly human-to-human transmission. Meaning, si sandfly, kumagat sa human number 1, nilipat ang infection kay human number 2. Diba? Human-to-human lang. But, in rural settings, wherein nandun ang mga farms, nandun ang mga animals, diba? So, the sandfly will bite the animal, get the parasite and transmit it to the human and vice versa. So, nagkakaroon ng animal to human transmission. Human infection is also sporadic and sometimes accidental. Again, this infection is zoonotic and it is capable of affecting or also infecting different animals like rats, gerbils, squirrel, canines. And this is prevalent in Africa, Kenya, Italy, and Oklahoma. In terms of prevention naman, since again, the mode of transmission is insect bite, anong gagawin natin? Di wag magpapakagat. How? We do vector control or we use insect repellent. Aside from skin or aside from insect bite, yung mga minor routes of transmission include blood transfusion, sexual contact, and congenital transmission. So, how are we going to prevent this? Pag nag-blood bank kayo next year, malalaman natin na yung mga blood bags pala na dinodonate, blood bags pala na pinaprocess sa laboratory, part pala nun is yung pag-detect ng infections. Kasi ang dami palang pwedeng matransmit through blood transfusion. So, yun yung isang trabaho ng medtech. Sexual contact. So, yun. So, you have to be careful who your partner is. Dapat wala siyang infection kasi pwede kang mahawa. Congenital transmission. So, the mother, you have to treat the mother before that infection is unfortunately or before that infection will be unfortunately transmitted to the child o i-treat muna ang mother. So, these are the minor routes of infection na pwede din naman nating i-prevent. Okay, and to end our discussion, this is the summary of everything that we discussed. Pwede nyo pa itong i-extend, lagyan yung mga annotations para mas maalala nyo yung mga infection or yung mga parasite, yung mga infection na kinokos nila, and yung mga vector nila. You can also read more, or know more about our hemoflagellates by reading Table 2.7, Summary of Blood and Tissue-Dwelling Protozoan Human Infections. And that is it. That is the end of our discussion. So, thank you for watching. If you reached this part of the video, congratulations kasi tinapos mo siya. And I hope you learned a lot. Take note that this video will be part of your semi-final exam. So, study well and I wish you all the best.